How are new PET scan tracers being developed to improve imaging? Have you ever wondered how medical imaging is evolving to provide clearer and more accurate pictures of our bodies? One of the exciting advancements in this field is the development of new positron emission tomography scan tracers. These tracers are molecules labeled with radioactive isotopes that help visualize physiological processes by binding to specific biological targets. Let's break down how these new tracers are being developed to enhance imaging. First, researchers are focusing on targeting specific biological markers. New tracers are designed to bind to precise molecular targets linked to diseases. For example, a new peptide-based tracer labeled with fluorine-18 targets PED-L when expression in head and neck cancers. This tracer is more effective than traditional tracers, allowing for better identification of tumor cells. This can help doctors make more informed decisions about immunotherapy. Next, improving the half-life and stability of tracers is essential. Many current tracers use carbon-11, which has a very short half-life of about 20 minutes. This limits their use in clinical settings. New tracers labeled with fluorine-18 have a longer half-life of approximately 110 minutes. This allows for broader clinical application and distribution. For instance, novel tracers targeting the histamine H3 receptor in the central nervous system have been developed with enhanced stability, improving imaging of neurological conditions. Another area of focus is enhancing imaging of neuroinflammation and brain disorders. Neuroinflammation plays a significant role in many neurodegenerative diseases. New PET tracers are being developed to target specific enzymes involved in inflammatory pathways. For example, tracers targeting phosphodiesterase for B in microglial cells provide higher quality images of brain inflammation. This can lead to earlier diagnoses and better treatment strategies for diseases like Alzheimer's and Parkinson's. Advancements in central nervous system imaging are also noteworthy. New tracers targeting receptors like the histamine H3 receptor are being created with improved specificity and longer half-lives. This helps accurately map receptor distribution in the brain, supporting drug development efforts. Additionally, integrating these new tracers with emerging imaging technologies is a game changer. The combination of advanced PET imaging hardware with new tracers significantly improves image resolution and sensitivity. For example, newly installed PET cameras can visualize smaller brain structures, which is crucial for diagnosing conditions like Parkinson's disease. Finally, the clinical applications of these new tracers are expanding. For instance, fluorine-18 fluoropyridase is being tested for cardiac imaging. This tracer quantifies myocardial blood flow reserve in patients with coronary artery disease. If successful, it could position positron emission tomography as a first-line diagnostic tool in cardiology. In summary, the development of new positron emission tomography scan tracers focuses on creating molecules with higher specificity, longer half-lives, and improved imaging capabilities tailored to specific diseases. These advancements reflected the integration of bio-integrated computing and emerging technologies in medical imaging, driving precision medicine forward.